Welcome back. Today we're going to be addressing osteoarthritis. Osteoarthritis is a condition where the cartilage has worn down in the joint and then you're writing bone on bone. It's different than rheumatoid arthritis, which is a blood pathogen, and so it's a disease of the blood, and stretching and exercising are not going to affect individuals with rheumatoid arthritis. So what we're dealing with is osteoarthritis. We've had several questions, people asking about it, whether they can do stretches and exercises, and yes, you can. Generally, when people have osteoarthritis of the hands, specific joints, finger joints, thumb joints, what happens is that when you actually look at the film, you will actually see that it's generally the anterior, the front portion of each joint, and not the extensor portion of each joint that is worn down, that is affected with the osteoarthritis. So that concludes to one reason. What are we looking at? A muscle imbalance and overuse in flexion. Well, that can be corrected by performing specific stretches for the fingers, and then of course using the FlexTend, strengthening the extensor group here, okay, which then keeps the fingers. It builds up the muscle in the hand, and when you build up muscle in the hand, it acts as a cushion and reduces the amount of pressure on the joint. So what we want to do here is I'm going to stretch my wrist and fingers backwards, just like this, okay? I can do it by, including the wrist, since the flexor muscles do cross that joint as well. I can stretch the thumb back, okay? So you're specifically getting the thumb flexors and adductor muscles, stretching those as well. I can do a straight wrist and just do the fingers only, okay? Right here, my wrist is still straight, just doing the fingers and or the thumb without, again, any motion at the wrist joint, still straight in line with my forearm. And so what we want to do is take the pressure off the anterior portion of the joint. So when you perform those stretches, you perform 3 sets, hold them 12 to 15 seconds. You can even do joint segment stretches where you're just doing each individual finger, mainly the joint that's affected, okay? And so what we want to do though then is strengthen the extensor group. And it's interesting is what you can do is you'll watch people when they're like just standing and relaxed, and you can tell if someone really has a flexor muscle imbalance and issue. So I'm going to stand up here, and you may not see my head now, but when people stand, you can see that their hands are like, see my hand how it's relaxed, but it's curled. Obviously my flexor group is much tighter than my extensor group because my hands are not relaxed and just hanging like this in a more straight fashion. You'll see some people who actually, their hands, their fingers are curled as much as this. That shows a significant muscle imbalance. So what we want to do then is correct this imbalance, build up the extensor group, because the flexor group, when it's tight, think about it, it's going straight from your fingers to the medial elbow, okay, medial epicondyle. So it's pulling in a straight line. So yes, it's flexing downward like this, but it's also putting pressure straight down on each joint, okay? So what we want to do is, when you increase muscle mass acts as the cushion and relieves the pressure on the joint itself. So if I build up muscles, they'll actually begin to cushion, especially if it's when you equalize muscles, they act as a cushion and take a lot of the stress off the joint. The key here is to use FlexTend to correct the muscle imbalance. The first exercise I'm going to do here, palm up, isolated, okay? Second exercise, rotate the arm strap so it's on the inside of my elbow, thumb up, isolated, sending my wrist and fingers. Third exercise, I'm rotating underneath my arm, palm down, isolated. This right here will take the pressure off the anterior portion of the joints, okay? And we never finish in the palm down position. I would actually now rotate it back up, and all the exercise programs always finish in the palm up position. So by strengthening the extensors, it's going to take pressure off the anterior portion of the finger joints and reduce the symptoms of osteoarthritis. Thank you for watching this video, and we look forward to hearing some of your comments and your requests for other videos. Thanks again.